Julia joins us now, and Julia, the first thing we need to ask is, how are you doing?
I'm doing great. I am. I was in complete darkness, but now I'm seeing so much better and so blessed.
And this is all since the procedure that Dr. Berman did.
Stem cell therapy. It's truly, truly amazing. It's giving my life back.
And speaking of your doctor, Dr. Mark Berman joins us, and we left that tape piece on a bit of a cliffhanger. Explain to us the process, the idea behind it, and how much evidence there is, because clearly it worked for Julia.
Well, it's just dumb luck that your fat is loaded with stem cells. Dr. Orden can tell you about this, but basically 1 cc of fat can have as many as 1 million stem cells. So we'll get rid of all the grease and process these cells, filter them out, and we can give them back to our patients. The cell is basically like a building block. It's signaled by the inflammation or degeneration, and hopefully, if there's enough signals, that will tell the block what it needs to become. So in Julia's case, it's homing in the optic neuritis and that inflammatory area and helping to restore that part of her, injured area, and that restores her vision. The problem is we have to figure out a way to stop her body from tearing up this disease. It's very similar with multiple sclerosis and a lot of these autoimmune type conditions.
And the idea is that the stem cells basically stem the inflammatory tide in the optic nerve?
Right. They're basically, you have an injury, and they're repairing the injury with like tissue, as opposed to when we have most injuries, we think of our cells attacking it and forming a scar to repair the injury. Now we're repairing the injury with actually similar tissue. The stem cell can turn into or differentiate into the tissue needed.
Wow. So I guess what we're wondering then is, how long does this last? Does she have to get this done often? Because to me it looked like it was probably a painful thing. Like you probably have to recover from the lipo.
You do.
Okay.
It's a few days.
And how often are you going to get the procedure?
I'm going in between 6 to 8 weeks.
So, Dr. Berman, I think it's important for people out there to understand that this is an investigational procedure that you're doing, correct?
Dr. Orden, exactly right. And that's why we set up a large network. We actually have formed the Cell Surgical Network. It's made up of doctors around the U.S. and outside. They're all part of an investigational IRB-approved protocols. That's institutional review boards that approve your protocol. Our first study was looking at safety. Now we have about 9 or 10 other studies looking at outcomes, and we'll try to go from there. But you're exactly right. This is investigational. All our patients need to be properly informed. This is not something where we're, saying, hey, come on in, we're going to cure your eyesight or make you walk again. The low-hanging fruit is orthopedic injuries. What Julia has is completely, way out there.
And I'm really glad you brought that up. If you're watching this show right now and you are intrigued by stem cells, you should be. But if you're going to get treatment, go to someone who knows what they're doing. This is an IRB-approved investigational approach. So just make sure you don't go on any street corner and say, oh, I'm going to pull some fat out and try to cure all my ills. So just be very careful. But in this case, Julie, we're so happy you're seeing good results. Dr. Berman, keep up the great work.